Okay guys, now let's cover the different step of how to treat a child in CPR. Now before that, let's talk really quickly about how to define a child. A child is someone who is between the age of 1 to 8. A baby is someone from the age of 0 to 1. And an adult is someone from the age of 8 and above. Now the way in first aid that we determine if it's a child, an adult, or a baby is by size. So I don't want you guys to search for his ID or ask his mom how old is he. I want you to look at him and just assess. If he is a 7-year-old who looks like he is 12, then you should treat him like an adult and perform the normal CPR scheme. Obviously, I don't think a 7-year-old would look like he's 12, but you get what I'm saying. Okay, so let's go over the differences between the adult CPR scheme and the child CPR scheme. So, safety is exactly the same. We don't need to change anything with safety. We take care of our safety and we take care of his safety. When it comes to checking if he's awake or not, this is the same as well. We want to talk to him, we want to clap with our hands, and we want to pinch him. Then we will call for help and we will check if he has a pulse. All of this is exactly the same. Now comes the difference. When we check his pulse and we find out he has no pulse, we will need to perform chest compressions. The way we perform chest compressions on a child is a bit different. We will obviously not want to press on him as strong as we press on an adult, and for that reason we will use one hand. The general guidelines say that on children we want to have the chest compressions to be 4 centimeters deep, while on adults it's 5. But again, don't carry a ruler around, guys. You will just look like nerds. So what you want to do is you want to do it only with one hand. And just make sure it's a bit weaker, but generally it's harder with one hand, so it will probably be weaker anyway. The location where you perform the chest compression is also a bit different. On adults, we want to find the exact point between the nipple lines, so it will be exactly in the middle of his chest bone. On children, we want to find the spot too. We want to look at what is the line of the nipple line, but we want to do it exactly below it. So we find the line, and instead of putting my hand right in the middle, I'm gonna put it right below it, like this. Okay? And then it's exactly the same. I want to do it between 100 to 120 chest compressions per minute. Only now I'm just doing it with one hand. Now, after I finish doing 30 of these, there's also a few differences here. I look into his mouth, and it's the same. I need to clean whatever is inside of his mouth. However, the difference comes when we're talking about giving him mouth to mouth and opening his airway. So I don't want to tilt his head back all the way back like with adults, but instead I want to make sure that his eyes are facing the skies, okay? That way we should be just more gentle with children. So we will not tilt his head all the way back, but we'll just make sure his eyes are to the skies. Next, make sure that you don't give all of your breath to this child. His lungs are obviously smaller than ours. So look at his chest and make sure that it's rising, and then stop. And one last thing is, you don't need to count 5 seconds between breaths, but you need to count 4 seconds in between breaths. Okay? So after you cleared his airway, you want to tilt his head a bit, close his nose, and perform mouth to mouth. And count 4 seconds. Okay? After you did this twice, you want to continue to perform the chest compressions with one hand and perform 2 sets of mouth to mouth, and 30 chest compressions. And you just keep doing this until help arrives. And exactly the same as an adult, if you have a friend who can help you, make sure he keeps his airway open, and that you guys switch every 2 minutes. That's all the differences between an adult and a child, and we will next cover the differences between an adult and a baby. See you in the next video.